Good morning, everyone. I'm Dr. Susan Mara, and welcome to Dr. Mara's Medical Minutes. Today, we're going to talk about MCAS, mast cell activation syndrome, which is a new buzzword for an extreme elevation and release of histamine and leukotrienes and chemokines into the blood as a result of exposure to infections, mold illness, COVID, and it is absolutely debilitating. It's characterized by a number of different symptoms: flushing, hives, headache, gastrointestinal symptoms like diarrhea, bloating, irritable bowel, angioedema. Edema is the retention of water, and some psychiatric issues like depression, anxiety, um, even to a certain extent, some more serious things. They're starting to see that MCAS is playing a role in schizophrenia and bipolar. This shouldn't come as any surprise because MCAS is an adaptive response by the body to the invasion of something highly toxic and dangerous, like a tick-borne infection or exposure to molds. And what happens is the body mounts a response that is exacerbated by the presence of these infections. And the mast cells release excess histamine. And histamine is very pro-inflammatory. It's very inflammatory. And it causes a host of symptoms that have to be calmed down before you can even start to treat the infections. So documenting MCAS through labs is very, very difficult. I've only been able to do it once. And that's because measuring leukotrienes and chromogranin and histamine, we don't have sensitive enough tests to do that. And so they typically come back negative when in fact the patient is in full-blown MCAS. MCAS patients tend to be sensitive to everything: foods, environment, infections, toxins, things like glyphosate, which is sprayed on foods. It's a terrible, terrible pesticide, and it's dangerous. So MCAS is the response of the body to the exposure of all these things. And one of the ways that we manage it is through the use of cromolyn sodium, Zyrtec, Singular, Claritin, Allegra. And for natural treatment, we use things like HisDAO, which is diamine oxidase, which is an enzyme that chews up histamine, helps lower the histamine. We use a product called histamine scavenger, which after you use diamine oxidase, it cleans up the debris from the chewing up of histamine. And this supplement has rutin, it has luteolin, it has pine bark, aloe vera, bromelain, quercetin. This is a great product, and I use it in conjunction with HisDAO. The other product that I use is MC Balancer, so mast cell balancer. And I don't use it in everybody, but in people who have severe mast cell that need more control of the release of histamine, I use this. And this has things like luteolin, curcumin, quercetin, rutin, and L-theanine. So the combination of both pharmaceuticals as well as natural medicines, and as well as sort of controlling your diet by identifying the foods that cause an allergic reaction, can really help to dampen down the mast cell response and the release of histamine. And by doing that, you lower the inflammation in the body and you allow the body to more effectively deal with either infection or mold exposure. So I hope you find this useful, and I hope you have a wonderful day.